Today on From the Heart, we're talking about mental health. Often the focus is on our hearts, but for many of us, there are psychological impacts. There are parts of our journey that are really hard, and we don't always talk about them. Today we're going to talk about it, and we're going to talk about how we can take care of ourselves mentally and emotionally. For this conversation, I'm joined by Dr. Liza Morton. Liza is a counselling psychologist from Scotland. Not only is she an expert, she also brings lived experience to this conversation. She was born with a heart condition.
There are so many different, day-to-day challenges. I think that we're very used to them, so we don't always recognise them. But that can be cumulative and, understandably can impact on our mental health.
We're going to talk about some difficult things in this episode. Please make sure you're listening in a safe space. Remember that you can hit pause at any moment if you need to take a break. HeartKids can also help connect you to support. Before we begin, we'd like to acknowledge that we're recording on the land of the Gadigal people of the Eora Nation, otherwise known as Warang. We acknowledge the traditional owners and pay our respects to elders past, present and emerging. We pass that respect to any Aboriginal or Torres Strait Islander listeners. Welcome, Dr. Liza Morton. Thank you for being here. Where are you joining us from?
Hi, thank you so much for having me. I'm joining you from Scotland, where it's quite cold and autumn.
Beautiful. Look, I feel like many of us have been really excited to have this conversation with you. I have been chomping at the bit for this. So you are a clinical expert and you also have an experience of a heart condition. Can you tell us a little bit about, I suppose, first off, before we get into your professional work, a little bit about your heart condition and your personal life?
Of course. So I have complete congenital heart block, and I also had a hole in my heart, or atrial septal defect. So when I was born back in 1978, I was fitted with a cardiac pacemaker, and I was the youngest baby at the time. I was only 11 days old. So that was in Glasgow in Scotland, and it was very much pioneering. And my parents were kind of told they didn't really know what the outcome might be. It was all quite experimental. By the age of 7, I'd had 5 different pacemakers by thoracotomy, so where they kind of open the ribs up and put it on the heart. So I just remember being in and out of hospital all the time in those days, and those early pacemakers were set rate, so my heart rate was fixed. So I couldn't really be particularly active. So I wasn't allowed to do gym in school or sports days or kind of active play. I can remember being desperate to do dancing, so my friends were doing dancing and I couldn't take part in that. So it was quite tough in some ways, but I just kind of compensated, I guess. And I didn't feel particularly well anyway. But I can remember being in and out of the hospital all the time. And so most recently I was fitted with my 11th pacemaker, and that was 4 years ago now. And now, because I've had so many leads left in, it's quite complex pacing kind of surgery that I need. So
how is your heart now?
I mean, it is generally pretty good as long as I've got a working pacemaker. I'm 100% dependent. So every heartbeat I've had since I was 11 days old has been, well, even before that, because I was on an external device, has been driven by a pacemaker. So as long as the pacemaker's okay, then generally I can function pretty well. But I manage my heart condition pretty well. But it is always in the back of my mind. I do have to have annual checkups, and I know that I will always require further interventions and that they become more and more complex the more I have.
Yeah. I'm really interested about your area of research, which is trauma, and that beautiful connection between body and mental health and mind. I suppose for a starting point, can you tell us a little bit about how having a CHD and growing up with something like that can actually affect your mental health?
Well, I think in a lot of ways. I think that when we're born with a heart condition, we kind of, I suppose, underestimate the impact of that. So if, you might see with family or friends, if they suddenly have a heart attack or they suddenly are diagnosed with cancer, then they're expected to have an emotional response to that. And, there's all this kind of care provided and, support and counselling, and yet, we're born with something and somehow that's not meant to affect us. Of course it does. As a result of being born with a heart condition, and, I will caution that with each of us has very different stories, and this is a very heterogeneous group. So some people have very simple defects that, don't impact in their life, whereas some people have much more complex conditions. But within that, there is a greater risk of facing significant life challenges that aren't particularly kind of there in the general population. We have things like more exposure to missed schooling, missed education, discrimination. This is a hidden condition. So in some ways that's good, but in other ways it means that we mask it and we pretend that it's not there to fit in, but that can kind of create issues with identity, being able to receive the correct social support and access to social support. And often all of these things we're doing in isolation. So in life, when we face challenges, often our peer group is facing the same challenges, so we can kind of chat with them about that. Whereas often we're facing these significant adversities and nobody else has a clue what that means. There are so many different, I suppose, day-to-day challenges. I think that we're very used to them, so we don't always recognise them. But that can be cumulative and, understandably can impact on our mental health.
I think I've spoken about this before, but I had an anxiety depression diagnosis really early in life, and then I've had a PTSD diagnosis later in life. And at first I was like, oh, this is so weird. It wasn't until I'd heard researchers speak to be like, well, actually people who experience CHD have these diagnoses quite early in life, and we don't know that that's quite common.
Mm-hmm. And understandable.
I think it was very shocking to be like, wait a minute, like this is actually, I went through a lot as a bub, like this is very...
Of course. Yeah. So, the prevalence of anxiety, depression and PTSD is, the lifetime prevalence is 50% in the CHD population for adults. 50%, that is hugely, so much higher than the general population. So, and for me, my interest is, why is that? But also, what can we do about that? I don't think we should just accept that and say, well, that's how it is. And I think that, yes, there are a lot of reasons why we would be more vulnerable to developing mental health problems. But let's have a look at what factors contribute to that. Because we know in psychology there are a lot of risk factors, but there are also what we call protective factors. So within what I've termed psychologically informed medicine, what I've attempted to do there is to look at, well, what are the risk factors? What are the increased risks? And we know that, for example, with trauma, we're more likely to all of us can experience traumatic events, but that doesn't mean that we will develop PTSD. So, you can have a normative reaction to trauma where you recover from that in the kind of weeks after it and kind of go back to feeling okay. But for a smaller proportion of people, they will develop post-traumatic stress disorder. And the things that can contribute to that are feeling powerless, not having adequate social support, being isolated at the time. So there are lots of things that we could actually do about that. And there are also protective factors. So there are things that we know protect people. So those are things like having a soothing presence of somebody that's supportive, things like being able to create meaning from your experience, having kind of adequate psychological support, and also the sort of the beliefs that you attach with it. So if you feel like your life's at risk, you're more likely to develop PTSD. So we can kind of take all of that knowledge and then we could adapt our care provision. And I think that could be a lot more psychologically informed.
Yeah, beautiful. I think I really wanted to get your perspective as well in terms of, I know that a lot of the times in our community we talk about this, like it is what it is kind of mentality around our health, that, we're in a situation where we just have to do it and, we persevere and we're strong and we're powerful. But sometimes that mentality kind of takes away from the reality that it is, the grief of it. How do you understand, I suppose, that perspective?
I think that's a really good point. And I think the whole mentality, yes, of course it is what it is. And I think that, what you're kind of talking about there is resilience and a coping strategy, and all of that is very healthy. But I think it's important to recognise that resilience and coping isn't just about being strong and getting on with it. It's also about acknowledging when you need to kind of cuddle down under the duvet and have a good cry. And there are times where I think, it's completely understandable that we should get to do that. And I guess that resilience and coping isn't just kind of being positive. It's recognising that we are entitled to a normal emotional response to the difficulties that we face. And there's something unfair about being born with a heart condition as a child, so it's okay to acknowledge this is unfair, this sucks at times. And, a normal response to something being unfair is anger. So of course you might feel a bit angry at times. And I guess it's about learning to manage those difficult feelings, finding a space for them so that you can process them in a healthy way. Because we know that if we don't process these feelings in a healthy way, that's when we end up with anxiety, depression, PTSD. because we're kind of packing them all away and not kind of coping with them. And so, we tend to develop maladaptive coping techniques. So being able to find a way to kind of work through those trickier feelings and to acknowledge them and to validate them as a normal response, but to not get stuck there. So to kind of work through that, but then think, okay, but actually I'm not going to get stuck with that. Let's focus on what I can do, what I can achieve. I think, nobody knows better how precious life is than those of us with CHD, and we absolutely value that, and we want to make the best of our lives. And those aren't kind of two separate things. You can absolutely do that while also saying, but at times this is a bit rubbish and I need extra support.
I think that's it. Yeah, it's kind of like it's a dance with both of that stuff all the time, isn't it? You can be really grateful, but you can also be a bit...
That doesn't mean that you're not coping.
So the court, what is it? Like, I think I came home one day and was like, I don't want to cry about it to my housemate. And she was like, crying releases cortisol, babe. You're literally releasing stress. This is the only way to do it. You've got to get it out. Look, we've seen like the most mammoth kind of surgical and medical advancements in the past 6 to 7 decades. And now we're at a rate about 95% of children born with CHD survive into adulthood. And I know when we talk about the CHD stuff, and you would know this, it's so focused on our hearts and especially our experiences as bubs. But I really want to pick brain because I know that you have coined this term, psychologically informed medicine. I really want to understand kind of what that means in the scope of like prolonged life for somebody with CHD.
Yeah, okay, I guess, sort of building on that. It's sort of an approach, I suppose, to healthcare provision that, like you say, takes into account that this is a lifelong condition. I mean, it's not just about CHD, it could be applied to basically any kind of medical condition. But like you say, there are a growing number of people due to medical and surgical advances that are dependent on medical treatment. And I think that it's about a culture shift within kind of medicine to embody a more holistic approach, really, and drawing from the evidence base. So there's so much excellent evidence now that shows that a compassionate kind of care provision can extend life, can contribute to healing and recovery and well-being. And this can be measured in things like there have been studies by Field who showed that, for example, with infants in ICU, if they could hear and were touched by mum, they were more likely to survive. So this is, it is about psychological survival, but it's also about physical survival. So it's kind of an approach, I suppose, psychologically informed medicine, and it draws on what I see as important, going back to those protective factors, but also trying to mitigate risk factors to improve psychological outcomes, bearing in mind that we will have to go in and out of hospital lifelong. So each kind of time that you have that medical appointment or connection, it's important because that's kind of being added to that bucket, I suppose, of a memory and of what medical care is about. So it's about providing, I suppose, a kind of holistic approach that's trauma-informed and that focuses on compassion, like I said. So, for example, providing specific training to all healthcare providers about a compassionate kind of communication style. Because when we're at our most vulnerable, it's really important what people say to us. And I've had lots of care providers that have been great, but very often it is left to kind of the sort of bedside manner of that particular individual rather than being seen as something that actually this could be trained. It shouldn't just be the bedside manner, and people kind of accept, that surgeon's just not very good with patients. He's not very nice. He says crazy things. And you're like, well, that's not okay. So it's looking at things like that. Communication is very important. Also looking at disempowering aspects of care. So we did a study looking at things like the hospital gown. And that was from my own lived experience. I'd taken a selfie the last time I had my pacemaker because I was putting this backwards hospital gown for the millionth time. And I just thought, I'm at my most vulnerable. This is the worst thing that you could possibly put me in. I can remember I needed to have my weight taken and they'd forgotten to do it. So I had to walk across this really busy ward wearing this gown, surgical stockings, no underwear on, clutching the gown at the back, just thinking, could this get any worse? So there's lots of disempowering aspects of care that don't seem particularly necessary. And we know that feeling disempowered can contribute to increased risk of developing post-traumatic stress disorder. So it's important. And as a population who, we depend on medical care from childhood, there's lots of being disempowered, from infancy. So, and then we're expected to self-manage our condition. So it's like, well, no, that has to be embedded from the start. We need to be empowered to develop that self-efficacy and self-esteem and sense of being able to manage this health condition. The other thing that's important, I think, as part of that approach is developing a more healing environment. So hospitals, to me, are not very healing at all, particularly cardiac wards. And the beeping monitors, the harsh lighting, the being kind of woken up at 3 a.m. to have your obs taken. So yeah, I think that all of that could be more healing. And I know that there are medical restrictions, and obviously that has to come first in terms of safety. But I think that they could be designed better.
I think, yeah, it's really refreshing to have somebody who knows what it's like to talk about this sort of stuff. As soon as you're saying everything, I was like, oh my gosh, yes. There's so many experiences in that you look back on and you're like, wow, actually as a child, that's a huge thing to experience and walk away from. And no wonder, emotionally processing later in life is hard. So,
yeah.
Cool. As we're moving forward, we're kind of debunking the stigmas that we have around mental health, but we know that all care is incredibly important, and engaging in mental health treatment. I think there's about 69% of patients currently, that CHD patients, that aren't involved in a mental health treatment. Yeah. What is your thoughts on that number? It's quite high. I'm surprised by it.
It's very high. I mean, we know that this is an unmet need. It's underdiagnosed. It's not addressed. And even when it is found, it's not met. And my stance is that there should be a psychologist in all cardiology teams, congenital cardiology teams. I just think there should be. And it should be seen that psychological risk is part of the condition because of the unique life stressors and challenges that we face. And I just think that should be a given. We should be, if that was embedded from childhood, then we know that things like if we were resourced with tools to help us manage the additional stressors that we have, then that would be protective and we might be less likely, we might see those numbers, that 50% number come down somewhat as well. So it's about prevention as well as treatment. And that absolutely motivated my journey into psychology because I just thought something needs to be done about this side of things. We're told from wee to be brave, to be strong, and that's so much part of our identity that people really see this as a failing, and also that they are coming across as ungrateful. And so there's kind of a culture shift. And that has moved a lot, which is good to see, but there is still that kind of resistance there. So yeah, there's a lot of work needs to be done, but I would like to see psychologists embedded within teams for adults and children. I would like to see better recognition of medical trauma. I think that's vastly misunderstood and underdiagnosed.
Is it kind of liberating now to see that we are getting this kind of, we're talking about trauma, we're talking about the body and the mind. Does it feel good to be finally people are getting it?
Yes, it's amazing. Yes, yeah.
I think it's a really interesting space because we have this trauma as children, but you can never fully be free from your appointments when you live with CHDs. You're always going back.
I know, and that's what's unusual about it. Usually people don't have to go back to where that initial trauma happened.
I came out of an appointment once. I struggled with needles. I think as a kid I hated them and I didn't have many memories, but one came back one day and ever since I've hated needles. And have found the same thing where I'm I have to really emotionally prepare to have a blood test, to have anything, to be I came out of a appointment one day and was I'm never going to another appointment again. I'm never doing it. I'm not going back. But it's not viable. It doesn't work that way. So I'd be really interested in how, I suppose, from personal and professional, from your perspective, how do you balance, I suppose, honouring feeling unsafe and standing that in your body, but also being able to show up and do what your body needs you to do?
Yeah, that's such a great question. And there are lots of things that we can do to help ourselves feel safer. So while there are things that we cannot change on this journey, that doesn't mean that we have to ignore our own needs. And I think part of our journey can often be about re-engaging with our body, building trust in our body, looking after ourselves, because we've had to make that kind of split almost when we were younger. And so there's lots of things that can make ourselves feel safer. Often they're quite sensory, so things like smells, sights, sounds. So it might be that you have to go into the hospital, but you might kind of acknowledge that that is something that's very kind of difficult for you. So you might want to take a loved one with you, or you might want to, for example, if you're talking about a needle phobia there, I mean, that's something that could and should be addressed specifically through therapy. But you can also tell the team about that, make sure that they know that you have that, make sure that they kind of make sure you're lying on a bed, you're not sitting up, that you are given kind of cream so that you don't feel it. You know, all of these things can be added in, that you're given extra time if you need time to prepare yourself. You can do breathing exercises beforehand. So there's so many things that we can do to help ourselves feel safer. Also rewarding yourself. So kind of saying, well, that was actually really stressful and now my feelings of safety are really low, so I need to go home, I need to cuddle up in a nice duvet, I need to put on a box set that's nice and comforting, eat nice food, surround myself with loved ones, really take care of myself. So, you know, and do what I need to do to recover. So we need to kind of build in that recovery. But part of that's about acknowledging and validating the impact it has. And that's the bit I think that gets lost a lot of the time in that just get on with it attitude.
Look, I think that's entirely, we just get into the head. I can remember as a kid being like, all right, we're going to go into the hospital, we're going to do it as quick as possible, we're going to get through it, and we're going to act like nothing happened on the other side. Now, I treat myself like crazy after every appointment now. I need to put like a spending limit on my card after it. It's crazy.
Yeah, I was exactly the same. That's perhaps a coping strategy as a child, but you know, sometimes we develop these coping strategies and then they're not so successful as in adulthood. And, you know, if things had been different, maybe if there had been play therapy or other things when I was younger, that would have been useful at the time. And I've got no doubt it would be, but that wasn't on offer. So, yeah, I think the way that we dealt with that is maybe to have shut that down. But then that's, see, when it kind of pops up as adults.
I think how do you cope in it? You know, might not have experienced this, I don't know, but I suppose, have you ever had that kind of the guilt of a feeling as an adult being like, oh, I shoved that down as a child, now I have to deal with it?
I mean, I think that I get what you're saying. And I think that it's about you developing compassion for that child and developing compassion for yourself and understanding that as a child, we have got a lot less power and control. There are choices we can't make. So, and we also don't have the same rational thought. So we can't think things through in the same way. You know, because those parts of our brains have not been developed. So if you thought about another child, and sometimes it's helpful to think about somebody else, but if you thought about another little girl who was going through that, there's no way you would turn around to her and say, well, why didn't you deal with that at the time? You know, you just wouldn't say that to a child. So why would you say that to yourself? So it's trying to develop that self-compassion and thinking, I did my best at the time, you know, absolutely 100%. And this has been challenging. And I guess it's trying not to attribute blame as well. So, you know, I can maybe think, well, if there had been support, if I had had play therapy, if there had been a therapist. But I have to acknowledge that the knowledge wasn't there at that time in the 80s, you know, the late 70s, the 80s, the 90s. We didn't know this stuff. Nobody knew this stuff. So, you know, we're not only are the medical community learning on us in terms of our cardiology, the psychology community are learning about medical trauma. We're learning about the impact of early adversity and adverse childhood experiences. So it's kind of taking all of that into account as well.
Yeah, I can remember having a conversation with my therapist being like, I am struggling with that. She told me to put a little picture of baby me on the back of my phone. Yeah, and every time I wanted to get angry at myself, just to look at that picture and be like, you can't get angry at that, can you? Like, you cannot.
No, you can't get angry at that. No.
I'm really interested as well. So obviously I struggle about the what if going forward. What's your experience and your research around kind of like the anxieties of life beyond where we're at right now?
Yeah, goodness, that's a bit of an existential one. I think that's obviously that's challenging for all of us, and we have to kind of, I suppose there's different bits to that. So there's the kind of thinking about future medical procedures and all of that kind of stuff. And we cover a lot of this in our book because it is quite unusual, like I said, to have had traumatic early experiences and then throughout life and then to know that you have to face that again. And so again, it's about acknowledging those feelings and trying to give yourself space to validate them, but then also not getting stuck in them as well. And we know that it's one of the things that's really important is being able to create meaning and a sense of purpose. So, you know, if you're kind of living a meaningful life, that can be really helpful. Certainly, I find that all of this stuff that I do, the advocacy work, the research, all of that has given me a way to create a kind of sense of meaning out of my own experiences and given me a sense of purpose. So it feels like, it's not been in vain. All that kind of suffering and pain and hurt has not been in vain. And so that's really important. It's also important to remember that actually the quality of life for CHD patients is surprisingly high. And there's what we call post-traumatic growth. So, and that is the kind of positive adaptation. So people who've had these early kind of childhood experiences are more likely to value life, have meaningful relationships, be more determined, be kind of have a stronger sense of purpose and meaning, and sort of value their life experience. So there's that side of things as well. And that's kind of, we've referred to this as the gifts of CHD in our book, but we kind of go into that too. So we're less likely to kind of get caught in the rat race and just kind of get on with it and be more reflective and think, actually, what do I want out of my life? And recognise its value and its purpose, often from a very young age.
Look, you did briefly mention the book. Tell me about this book and when can I get it?
Okay, so this is really exciting for Tracy and I. So Tracy Levesque, she is a licensed clinical social worker. She lives in Connecticut in the States. We have never met in person, but we met online due to our kind of joint advocacy effort. So we wrote the book that we'd both been looking for since our teens, and we're incredibly passionate about it. So it's called Healing Hearts and Minds, a holistic approach to coping well with congenital heart disease. And we were absolutely delighted to get a contract with Oxford University Press in New York. So it's published by them. You can pre-order it now through Oxford University Press, I think on Amazon now. But it's officially launched, I think, on the 13th of January.
Nice. I'm going to add it to my cart.
Totally. We just wanted to create a book for our community and, that's full of hope and connection, but that very much validates the unique life journey. And totally, like I said, kind of remembering that all of us have got a very individual journey and that can vary enormously, but just kind of validating that there's a higher risk of having these increased unique life stressors, and it can impact on every facet of our life and what that means. And then covering things like discrimination, ableism, how it can impact on your finances, your education, your relationship with your colleagues, and just trying to embed kind of practical recommendations as well.
I'm so excited. I've searched high and low for every piece of literature that can kind of cross over on the experience. The Body Keeps Score, like essays about growing up with disabilities, and found pieces of myself in it. But this is going to be a gift. Kind of celebrate the closer we are to normal, but we've got that distance from it, and it's a very niche experience. It's a very niche, very beautiful experience. Yeah. Thank you. This conversation has been incredible. It's been so wonderful to get your perspectives and all of your knowledge, both professionally and personally. It's been really beautiful and very validating, and I'm very, very excited for people to have this beautiful little gift of a podcast to listen to it, because, my God, I wish I had it when I was younger. So thank you.
It's been lovely to speak to you. And thanks so much for your interest in this work. It's something I'm hugely passionate about, and I just love to see, the kind of growing awareness and, support.
Sometimes this podcast deals with some heavy things. If this brings up anything for you or somebody that you love, it's important to reach out for help. The HeartKids helpline provides support and guidance for anyone impacted by congenital or childhood heart disease. You can call the helpline on 1-800-432-785. To access more information about childhood heart disease as well as support from HeartKids, visit the website at heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect your or your family's health.